Do you know what an emergency is? I just to see if someone is bleeding, it's an emergency. Actually, in the hospital, it's not like that. Jackson Kamas. That guy was very intelligent. He made me question my intelligence. So it was not an easy journey.
How many were you in your first?
2,500. Only 180 of us made it to become doctors. Medicine is a different animal. You need to study every day. The thing I would like to tell you is that medicine is ever evolving. The same drugs that we're using today, tomorrow we cannot use them. Internship is actually the worst class you'll be in. One of my friends called me that day, he asked me a very funny question or a very interesting question. Why do you doctors drink a lot? We used to go UTH underground, the mortuary there. Mm-hmm. We used to go and cut dead bodies. To be on the honest side, medicine, our career, we need help because we don't know when to ask for help. Dix has just given me a different view on life. Even if I'm called at 01, say come to the hospital, I can go there.
Would you say there's teamwork among doctors? Back in the days, when one is asked of a question of what they would want to become in future or when they grow up, usually the answers would get is, I want to be a medical doctor. And those are the answers we usually got in class. And many of you maybe mentioned that you would want to become a medical doctor. Are you a medical doctor now? What is the current situation? I am not. Tendai is a nurse. She wanted to be an accountant in school, but life changed and she found herself in nursing. Tendai, what happened?
I don't know.
Circumstances of life changed. So this is a smart podcast where we discuss healthcare. And this is your number one leading podcast that discusses advanced healthcare and priorities around the healthcare. Sponsored by Elitrasmart Medical Supplies Limited, your number one producer and maker of healthcare attire. So if you're a nurse like Tendai, you have Elitrasmart to contact. The numbers are there on your screen. You're a doctor, you have Elitrasmart to contact, the numbers are there, and we have branches from across the country, and we deliver in good time. You look traditional today. What's the occasion?
I'm going for my chilangamuli after the podcast.
You have a chilangamuli?
Yes.
Oh, for your friend?
For myself. What do you mean for my friend?
Oh, for yourself?
Yes.
Oh, you're getting married?
Yes.
Someone is marrying you?
No, I'm marrying someone.
You're marrying someone?
Yes.
I thought so. How have you been?
I've been okay. It's been a while. We've met.
Oh, yeah. Welcome to the new year.
Thank you.
Yeah.
We didn't meet this year?
No.
How come?
You are preparing for your chilangamulilo.
Not so much.
No, so please give us some invites. We'll tell our followers, our audience to... we can even stream live. Jeku is there, can do the live streaming.
They can all attend, so long they can wear Elitrasmart uniforms. That's the only pass to the chilangamulilo.
Ah, is that so?
Yes.
Then you are invited to Tendai the chilangamulilo in March. And of course the wedding is...
How is it coming much?
Oh, it's today?
It's today.
Lovely.
So I should all rush to Elitrasmart shops, branches, and get themselves the uniforms, and they'll attend.
The chilangamulilo.
Yes.
Well done.
Thank you.
Okay. So today on the Smart Podcast, we have a special guest, who's going through the School of Medicine and now a medical doctor. Doc, welcome to the Smart Podcast and thank you for joining us.
Thank you, Mr. Karava. Thank you, Tendai, for hosting me. My name is Dr. Mkandawire. A current junior resident practitioner at Levi Mwanawasa University Teaching Hospital.
Interesting. Now, Doc, like I had mentioned in my introduction, most of the people, I wasn't among them. I think from inception, I wasn't among those ones who would go into natural sciences.
Okay.
Yeah. Not that I wasn't bad in class. I was one of those the good ones in class.
Brilliant one.
Yeah, not the very low.
Somewhere there.
Yeah, just somewhere there. But I would have done medicine. But it's not one of those things I envisioned myself to do.
Okay.
I think mine was just into natural sciences. Though life happened, and then where I am now, I'm discussing medicines. I'm into health. Unfortunately, but fortunately, it's something that is good.
It's similar to your calling.
Let's pick it up. Let's pick it up from where it began.
Okay.
How did you find yourself studying medicine?
Okay, it's quite an interesting journey. For me, how it all started was I was good at business studies.
Mm-hmm.
Yes, but I didn't see myself going into the medical field per se.
Mm-hmm.
But I saw when I visited one of the hospitals, I saw the queues at the hospital, the way people, the delays. So that prompted me to say, we are lacking something, and I can also contribute to what is missing in this country.
Mm-hmm.
That's where the journey started. Actually, it started in grade 10.
Grade 10.
Yes. So when I was going to do my medicals, I saw the long queues at the hospital. Then I was like, why not take part in this?
So that you reduce the long queues.
So that yes, so that I contribute to the service of the country, because I saw, it's very painful to see someone waiting for a long time on a line, okay, and this patient is unwell. So I just thought of it like, okay, I didn't take it to be serious, but it stuck to the back of my mind, and when I completed, I just went for it. That's how it all started.
Interesting.
Yes.
So now, just tell us a little bit about your background so that we get to know you better.
Okay.
Who is Dr. Mkandawire?
Dr. Mkandawire is a man of all trades.
Mm-hmm.
Okay, I'm an author. I'm a medical advocate. In my free time, I like to grasp new concepts, learn on what's trending. I'm also into tech. Okay. The other thing about Dr. Mkandawire is that I'm self-driven. I like to do things not when I'm taught, but just as a person. I like to learn new concepts about life. And I'm also into soccer. I love soccer. I support Chelsea. Yeah, and we won yesterday. So, yeah.
Yeah, for the first.
Big up to the Blues. It's a big team. Yes. So, yeah, Dr. Mkandawire is just a simple and a humble human being who's willing to contribute and also self-motivated. And the background of medicine side from grade 10 going up there, I always told myself I would like to contribute to the medical field. And eventually, that's how I got into the medical field. And currently, I'm practicing at Levy.
Where did you do your medicine from?
Oh, yeah, I did my medicine from Lusaka Apex Medical University. Yes. And I obtained a bachelor's degree in human biology and also a bachelor's degree in medicine and surgery. So those were two graduations. Then I transitioned to the practicing part.
Interesting.
How was your journey in uni? Like, those challenges people saying, medicine is a bit hard, there's biochemistry.
Yes.
So, like, you can take us through, maybe there's somebody out there who wishes to be
Okay.
a doctor like you.
Okay.
And they have to learn before they even go into it.
And I think even what's the human biology aspect and everything else, and I think even maybe before he even touches on his journey into uni, maybe let's just take him back to primary school, secondary school, because I feel this is where the interest comes. If you're not good in science, how do you then do your medicine, your biology, your chemistry, your physics? Just walk us through your secondary school journey.
Okay. My secondary school journey has been quite interesting. I've been a boarder for most of the time. Okay, so I went to St. Paul's Secondary School in Central Province.
In Central Province. Where's home?
Home is in Osaka.
Uh-huh.
Yes, so I went there for boarding from grade 8 to grade 12. And yeah, basically, it used to be cool to be found around the Red Cross Society. So that journey also, when you're found with that society, they call you doctors per se without even being practicing. You're carrying that first aid kit. So from there, interest also just started beginning, and yeah. But per se, in secondary school, I was also good at mathematics, the sciences, and I was good at them, but I was more good at business studies. So I was tangled into two things. I had the choice to go and do economics or to tip into medicine.
So that's after your grade 12 results?
Yes, after the grade 12 results. Because actually I wanted to tip more into the business side, because I used to do very well in commerce. Okay. At the point I was even given best graduating student, I was like, this is my calling. Let me go and do this. But I remember the experience I had at the hospital when I was going into grade 10. I was like, people need help this side. Okay, business is easy because it has its challenges, but my heart, that memory which I had at the hospital was like, I need to be one of those people who are going to at least assist in one way or another. So that's how I decided to transition into med school. But of course, I did well with the sciences and the mathematics, because before going into med school, you need to qualify. And the basis of qualifying, you need to have your English, mathematics, the science, and your biology. Yes. So if there's someone who wants to do this career, you need to have all those things at your best level. You need to get at least credit or better, but it's very competitive nowadays. So you need to have a distinction. Yes. Then from there, as Tindai has asked me how was my medical journey. Medical journey for me, it started. It's a cave. Okay, it was like, what do you call it, a roller coaster? Yes. So when I entered med school, I was very excited. You find that the first semester you pass.
Yes.
You get the A's. But after the first semester, you start reducing, and so it was not an easy journey.
How many were you in your first year?
In our first year, we were about 2,500.
2,500?
Yes.
And how many survived the first exam?
So we only graduated about 180.
Wow.
Out of those 2,500. So only 180 of us made it to become doctors. And from that time, so it was like they put you in a class and you have to make points. NS, we call it NS. Okay, so we did it for 2 years. We do pre-medical for 2 years. Then from there, you transition into preclinical or preclinical studies. Then you go into clinicals now. So those 2 years are for what we call safe-in levels. They're going to get the cream. And from there, you're going to do preclinicals. And you go into clinicals. That's where we work. When you're doing clinicals, you work in the hospital, actually. But you're studying to be a doctor. Yes. So the issue about medicine is what makes it difficult is not about you can be a brilliant student and still have challenges. Yes, that's how medicine is designed.
I think I know of some people who failed. Like they went to do medicine and they failed. They came back.
What are they doing?
Others, unfortunately, they fell off on the other side of life. But others went to do nursing.
No, we went to be teaching.
No. They went to something that is a little bit easier from medicine. So instead of doing medicine, they went to nursing so that they can have an easy way out. Just like you did.
What do you mean?
You failed your... Yes, doc.
Yeah, so that's a clinical arrangement. So you do natural sciences first. Okay, so out of those 2,500, you make points.
Yes.
After you make some points, you go into the clinical arrangement where you do 3rd year and 4th year. I actually did it for 7 years, but now it's 6 years. Yes. So what if someone is watching?
That's
now,
medicine.
Yes, that's medicine. So medicine is in actually 3 chapters. So you do the preclinicals or the NS is 2 years, Then the preclinicals is another 2 years, so 4 years. Then you get what we call a human biology degree. Yes. So when you get that human biology degree, some decide to stop. They'll be like, okay, for me, I think this is where the journey ends. After 4 years, I'm done. I can do other things. You can actually specialize. You do your master's in maybe biochemistry. You do a master's in anatomy. You do a master's in physiology.
But you still be referred to as a doctor, or you are called something else?
You can be called a doctor, but not a real, in terms like a doctor practicing in the hospital.
So you can't practice.
You can't practice with a human biology degree. But you can just be called, you can do your master's, your PhD.
No, so wait, you said it's in 3 stages. So there's a first 2 years, which is the first stage.
NS, yes, NS.
And then the second, the third and fourth year, which is the second.
Yes.
So now when you transition into these other years, what is that? That's the third stage?
That's the third stage, which we call clinicals.
Okay, so the human biology or maybe ends at the fourth year.
Ends at the 4th year, yes.
Okay, so you cannot practice as a medical doctor if you do not go into the other.
Because what actually makes you a doctor is when you go to the hospital. Now, in your clinical years, when you have patient to doctor interaction.
Okay.
Yes. So when you go to your 5th year now, after you get your degree, that's when you become a doctor now, or you start practicing to be a doctor. Okay, so basically those 4 years are basically you learning about the body, the anatomy. Okay, I remember when some people stopped when we were going to UTH. We used to go UTH underground, the mortuary there. We used to go and cut dead bodies. Okay, those dead bodies, we call them cadavers. Cadavers, yes. Okay, so those dead bodies now, they have a funny smell. Where they put a chemical called formalin.
So when you say you went to cut dead bodies, what do you mean?
Okay, so anatomy is a practical course. So we used to learn the theory in class. Then after you learn the theory, we have to go and see the actual human body, okay, which has been preserved with different chemicals. And from there, after we cut, you identify. So we used to put pins. Okay, this is the nerve, these are the muscles, just like that. So you find it's just a proper human being, and that's why we learn from. That's where the actual practice starts from. You start learning from your anatomy there. That's how we used to do it. Okay. Yes. So when you do your 4 years, that's when you become now a doctor in practice. We call it a doctor in practice. Yes. So now, after you finish that 4 years, you need to go to the hospital and have one-to-one interactions with patients. You learn procedures and how to respond in terms of an emergency. Yes, I remember when the first time I went to the hospital, it was very embarrassing.
What happened?
I saw a patient; they were bleeding from the hand. Okay, and I was just a student. Then I went to the nurses. Emergency. And they were laughing at me like, this student who's come is very excited. He doesn't know what an emergency is. I didn't know what an emergency is. I just to see if someone is bleeding, it's an emergency. Actually, in the hospital, it's not like that. We need to check the vitals to make sure the patient is not in shock. And we triage. We call it triaging. We choose which patients need to be treated first, depending on the severity of their condition. Okay? So
you choose which patients to be treated first?
Yes, we choose. So in the hospital, you can come in now. In fact, we'll talk about that as we go on. Yeah, but let me talk about the school part. So for students watching this, and someone wants to become a doctor, students have passed their grade 12, and they want to be a doctor. When your points don't matter in med school, that's the first point I'd like to tell you. Your points, leave them behind. They are good points, but leave them behind. When you enter med school, what will take you apart is your determination. You need to be more determined than you've ever been in your life. Because you're entering a field whereby some things will not be taught to you. Some things you have to teach yourself, self-learning. Because sometimes you might find in a course, a lecturer just gives you the module and the curriculum, and you have to start pinpointing how you're going to hammer it. Yes. So Determination is what takes you far in medicine. The other thing is you need to be courageous. Okay? You need to believe in yourself. What I mean by believing in yourself is there are days where you will fail an exam. But that's not the end of the world. Okay? I remember the first physics exam, it was a surprise quiz. And I was one of the lowest. And my friends laughed at me. The surprise quiz guy, they give your friend mark each other.
Yes.
And the answers they are marking. Okay. Then I was one of the lowest. That was a reflecting point for me. I was like, am I in the right field? I was like...
That was in first year?
That was in second year.
Second year.
Yes. That is when we were making our points to actually transition into the preclinical side. So I actually questioned myself, like, am I in the right field? Okay, but it was a turning point because it taught me how to believe in myself. Okay, so for the students out there, the grade 12s who have just finished, you need to be determined, courageous. You may fail sometimes, but you need to always, that's why I call it self-learning. You need to study yourself. Okay, because some students have got very funny habits. Drinking throughout the weekend. When you go to university, the thing is that you have got freedom. Freedom of choice. Today you can go out and party. Tomorrow you can call your friend, let's not go for class. But as a student, you need to be self-disciplined. You need to learn yourself. What works for Tendai, what works for Mr. Kalava cannot work for me. Okay? What works for another person cannot work. You need to study your strong points. Some students are very fast. I had a friend, Jackson Kamasa. That guy was very intelligent. He made me question my intelligence. Because what he used to do is to come for class and just sit and look at the lecturer, and he grasps everything. No need to study. Okay? And for me, I'm a person whereby when I just need to hear the lecturer, then I go and study and I go and pass through again. So you need to learn yourself. Otherwise, if you follow what your friend is doing, you'll be injured and you'll find that you are not progressing in the medical field. And the other thing is you need to put God first. Okay? Because this field is a calling. What we mean by it's a calling, it will take most of your time and it requires you to put in your full heart, not just today I feel like studying. There are those courses where today you can study, tomorrow you cannot study. Medicine is a different animal. You need to study every day. For me, I can tell you today, I study more than I was a student. Even before I came here, I was studying a topic. That's how it is. Yes.
Do you feel the grade 12s or those ones, the young ones, should still study medicine?
That's a tricky question and a good question. In the sense that medicine, if you want to study medicine, study it for a passion. Okay? The grade 12s who have just finished, study medicine for passion and don't study it. It will give you good returns. But medicine is a field where you have to work for it. You have to sweat for it. In fact, not medicine, in healthcare, as Tindai can attest, in healthcare, you have to work for it. You have to labor, make sure that you suffer for it. Okay, so for the grade 12s out there, medicine is still a good career. And I hear, we're in a generation where there's no mentorship. Medicine is a good career because it gives you unlimited opportunities. Okay, you can start a health talk. You can go and practice abroad. You can practice here in Zambia. Okay, you can do different things with a medical degree. It's just that we're in a country where we are limited to our thinking. We think, if I'm not employed, I should just, sit down. You get what I mean? But once you finish your internship, you can do something with that paper. Okay, so for the grade 12s, I'll usually encourage them to do medicine. Okay, because it's one of the top courses which you need to do in this country, because the doctor to patient ratio is still the gap is still high. Because at the hospital you find patients need to be attended to, but there are only about 4 doctors there, and 4 doctors maybe to, let's say, 2,000 patients. It's nothing. Okay, so we're in a field whereby we need more doctors, we need more nurses, and we need more health practitioners. Otherwise, we're in danger. If we know, the development of a country depends on science and technology. If you say no, for now, let the grade 12s not study medicine because doctors are not working, they are killing the nation. Because what happened some time back is you have to import doctors. And the best doctor who can treat you is your own Zambian doctor. If you rely on too much on external forces, those people are making themselves rich in their own countries. So I feel like for the grade 12s, go for medicine. It's very rewarding, and it might take you time, because one thing I've realized about medicine is you see your friends driving their cars first before you. You will see your friends having that life before you have it. So you need to be patient.
But
So
7 years is too much.
7 years is too much, but it's that 7 years is what makes us treat you in less than 10 minutes.
Yeah, in less than 10 minutes. Yeah.
So at the end of the day, yes, we're dealing with a human life. Okay?
Yeah, but also it's the doctors would deal with you in 10 minutes, but the nurse's attitude at times, it's something leaves so much to your attitude, you.
Yes, what do you mean?
At times it's very bad, terrible actually to patients. But of course they don't maybe understand the kind of work, but for others it's just there. Like their attitude is bad. For others maybe it's because pressure at work. So maybe they tend to leave those frustrations at the patients, or just, yeah. I'm sure you see them. I don't know if your attitude is bad. I've never been your patient before. Maybe I should get sick next week. And see how you treat them. But Doc, even before we go to internship, because I think we also just wants to find out on internship as well. You mentioned of your experience. I think by then you're doing your
clinicals.
your clinicals.
Yes.
Experience with dead bodies and cutting them. That experience and everything else. Does it have an after effect on your mental?
Actually, mental health in medicine is a big challenge for us, even us as doctors. Because a doctor, you're always seen, or a health worker, you always see, for example, you just see, she's okay, she works in health. What can I tell her? You see me, no, he works in health. What can I tell him? Okay, but these things affect us largely because we don't know when to ask for help. Okay, she might notice like, no, I'm not being myself at work, but she'll hesitate to tell me because she'll say, no, that one is a doctor. Maybe he knows what he's doing. You get the point, eh? So medicine is one of the fields which are highly affected by mental health struggles. Most doctors, most nurses, they struggle not because they do not know what mental health is, but they do not know when to raise their hand to say, I need help. Okay, at drinking, they're abusing alcohol. The same you call the ones who are going to be doctors, the ones who are going to be nurses, they are the most alcoholic people. Okay, well, I had one of my friends called me that day, like, he asked me a very funny question, or a very interesting question. Like, why do you doctors drink a lot? Like, myself, I don't drink. Which doctors have you seen? No, I have another friend who was at the bar and he's blacked out. It's like, no, maybe he's just having one of those days.
Good time.
But to be on the honest side, medicine, our career, we need help because we don't know when to ask for help. Because everyone looks up to us. And you know, when everyone is looking up to you, you think like, no, I don't need help, because how is she going to look at me when I go to her and tell her, no, I'm dealing with anxiety, I'm dealing with depression. Okay, she'll be like, but you didn't learn this in school. Why can't you diagnose yourself and give yourself some medication? But you know, there are different ways to treat conditions. So you need to have the first call for us is to ask for help, and we're not taught that in school. Okay, we're just taught how to grasp the concept and, you know, make it through med school. So for that point, it's a very good point. I feel like we need a lot of help as doctors, as nurses, as health practitioners, because of the fatigue. Some things that you're saying, I know these people are rude, we are rude. It's not because they want to. Maybe the same person you're saying is rude, they're dealing with a life crisis. Yes, their family is crashing at home, but they still have to come for work.
Yes.
Because they need to feed their family. So it's a thing which we need to keep on talking about, and we need to keep reminding ourselves, like, let's ask for help, because at the end of the day, it will be too late. The day I will say, no, I thought she was okay. It will be too late, okay?
Mm-hmm.
And in medicine, when someone is having mental health issues, it's rare that they even tell you. Because when she's wearing a white uniform, I'm wearing a lab coat, you'll be like, these people, they are very educated. They
with
know,
what's that?
with a stethoscope.
A stethoscope.
With a stethoscope, you'll be like,
Uh-huh.
these people are very knowledgeable. They can't get sick of these conditions, these mental health stigmas. But indirectly, we need to be vulnerable to each other and tell ourselves open, like, no, I think I'm crashing.
Yes.
Okay, sometimes fatigue can build on your mental health.
Mm-hmm.
You need to be honest, like, no, I'm crashing. The way, and I think she can attest to me, some people, you find that when starting work or when they are doing things, they are very energetic, but months later, you notice they start going down. Yeah, you can find a colleague is just going down.
So you reach out to them.
Yeah, so you need to ask, like, are you okay? So as medical practitioners, we just need to, health workers, we need to be there for each other. Okay?
Mm-hmm.
Yeah, that's what I would like to say about mental health, because it's affecting us in a big way. In a big way that we don't even know how to deal with it ourselves. So we need to keep asking for help, talking about it like we're talking about it now. Someone might get encouraged and say, oh, okay, I heard it from Dr. Mkandawire, I heard it from Tinda, I heard it from Mr. Calabar, so on and so forth.
Interesting.
Yes.
Interesting. So now let's dive into your internship. You are currently doing your internship at Levy. Tinda happens to be there as well. Yes, as what there? As a nurse. Okay, yeah. One of those ones who had.
She's one of the best nurses, actually.
Let's talk about internship. For starters, what is internship in the medical field?
Internship, I would like to describe it as a transition, okay? It's a transition from med school to now you enter your working period now. Okay, so it's a transition from after you finish your 7 years or 6 years, then you go into your clinical wake up now. Okay, what do I mean by this? It's a period of, it differs, okay, according to different hospitals. It can be 1 year, 3 months, 1 year, 6 months, some hospitals even 1 year. Okay, depending on how they are working using their curriculum.
It's also same with those who are trained adults on their own.
Yeah, it's actually, now it's the same, but then it used to be different. Actually, when you're foreign trained, you have to do it for 2 years.
Internship.
Yes, internship for 2 years. Because why it was like that? Because they didn't know if you're competent with our conditions back home. Okay, because for example, when you go to Russia, you might find some diseases that we suffer with here are not there. Okay, because those are developed countries. So they prolong it for those foreign trained students. Then for us who are locally trained, we're used to these diseases. So it's 1 year, 6 months, 1 year, 3 months. Yeah. So it's just a transition from being a medical student to now starting your life as a medical doctor. So that's internship. Yes. So from there, when you finish as a medical doctor, you're given what we call a provisional license. Yes, of which most of us have. It's a provisional license. What do we mean by provision? It's just the same as a driver's license. When they say provision, you cannot work alone. You work under supervision or guidance from a mentor or a senior above you. Okay? So that senior above you, it can be a consultant, it can be a registrar, but you can't work alone for those reasons, because you need guidance. Yes, the reasons why they're doing that is because when we're in med school, we are mostly observing. Okay, we do minimal conditions or like minimal procedures. Sorry. Okay, when I'm in med school, you find they'll tell you examine this patient. Okay, tell us your diagnosis, cannulate, catheterize, but it's not enough. Because our field is a practical field. Our field is every day you need to practice, you get better. Okay, so internship is about polishing your skills. It's about polishing, consolidating why you didn't understand, and now it's the real deal, because it's like they have thrown you into the water. You know, you're watching your friend swim. Now they tell you, no, go into the water, it's your turn. So it's about surviving. Okay, it's about thriving in a new environment. Now, you're the one dealing with the patient. You're the one to report on what you found. You're the one to cure the patient. Okay, so that's internship. It's quite an interesting period for a medical doctor in our country. So, what I'd like to say about internship is, even internship, as I have said for students, you need to know yourself. Even internship, you need to know yourself. Because why? What works for my fellow doctor might not work for me. Okay, but the principles remain the same. Okay, what you need to do as an intern is you need to study every day. Okay, because if you see a patient comes with a pneumonia, okay, one thing I would like to tell you is that medicine is ever evolving. The same drugs that we're using today, tomorrow we cannot use them because different guidelines have been updated, different articles have been updated. If it's in advanced countries, every day that they're doing what we call clinical trials, trying different ways to treat a disease, trying antibacterial resistance, all those things. So it's an evolving field, and you need to give it your best. Okay, so that's what medical internship is. Yes.
Interesting.
So, having heard what internship is, so now we come to you to hear your journey of internship.
Internship.
How did you feel in the first day as an intern when you reported that everyone else?
How did you even find yourself there?
How did I find myself there? It's quite an interesting journey. Okay, so when I finished med school, I went to work for the mines.
Where? On the Copper Belt? Northwest?
On the Copper Belt, Solwezi. Yes,
Northwestern.
so Northwestern. So I was just like helping out with some medical tests, not really practicing, just helping out where they need medical assistance. Then after some months, I decided to do my internship because I realized that you need to have to finish your internship to actually fully practice.
So when was that?
That was some like 1 year, 2 years, 1 year, 6 months ago. So now my journey as an intern is, my first day was very interesting. Okay, and I was very nervous. I was very nervous because now I'm no longer a student. I'm no longer hiding behind someone. You know, as students, we are in each group.
Yes.
So you hide behind your friend. Today, they ask a question, you're behind your friend.
Oh, yeah.
Yes, you're not actually practicing, like doing much. It's easy to hide. Now, you're the one seeing the patient. Whatever you do determines the life of someone.
So now that's at Levy now.
That's
You've left the mines.
Yes, I've left
You've left the mines.
I've left the mines.
Oh, okay.
Yes. So now, my first day was very interesting because, you know, you look lost. Okay? And people can tell that's a new doctor coming there. You look lost because you'll be asking for directions everywhere. Where is the lab? Where is the what? Where is the what? Okay? And
there's no orientation, Tendai.
No, the orientation is there, but you still get lost.
Oh, yeah.
It's a bit possible.
Okay.
You still get lost. You're like, okay, where's the lab again?
Oh, yeah.
It's this side. Okay. But I was very anxious on my first day. And, you know, when I met my boss, my consultant, he's a very funny man and very active. So he just started pinpointing questions. What do we do here? What do we do? So I expected to answer on gunpoint.
Yeah.
Yes, your first day there, you see a patient. No, a patient is having maybe a fracture of the femur. Then they'll tell you, oh, have you heard of a fracture of the femur? Yes. Oh, so what interventions are we doing now for this condition? Okay, that's your first
class starts. Back to class.
So internship is actually the worst class you'll be in because you'll be required to read more. Yes, so class starts immediately there. Oh, this is it. And you realize that, okay, I'm not a medical doctor, but I need to learn more. Okay, I have a lot to learn because, trust you me, what you read in the books and what you practice does not always, you cannot find everything in the books. Some things you find them in the clinical practice. Yes, so internship was the first day was quite hectic for me because I that's when I got oriented to what I need to do and everything. But as time went on, I got the hang of it. Okay. And the first thing is that you need to be good to people. You need to greet. Because some people, when they come the first day internship, they just bypassing and, people ignore you.
Oh, because they're in that lab coat and then they have a stethoscope and then they're just feeding all that.
Yeah, they're feeding all that. You're not even greeting anyone. Because for me, you need to even greet the people, the cleaners. Okay, because those people have been there for a long time. So you need to greet. They will help you.
Yeah.
They will help you with even what you don't expect. They will advise you here. No, let's do this. Let's do this. Yes. So my first day was quite anxious. I was very anxious. I can't lie to you. And that anxiousness went as time went on. It took me about 1 week to get used. Yes.
Okay. Interesting. So did you always want to go at Levy to do your internship, or at any other?
Actually, I've never had a site to say I want to do internship. That site. No. I was just like trying out.
Which one?
Which one? And Levy was the first one to respond.
Oh.
Yeah, so I just received the call and I went there.
Interesting.
Which department did you start with?
The surgery. Okay. Yeah, I'm now in OBS. And I met her from surgery.
Oh, okay.
Yes.
What do you do in surgery? You?
I do with broken legs.
Oh.
So your legs are broken for doing it or what?
No. So I can say but isn't yours what's that? Male surgical ward? No, it's so now you deal with broken people, with those ones with legs.
Legs, your arms, your stent, broken. The current or what?
Oh, okay, and then you know how to do the fixing and
Happens to you, God forbid, we receive you.
Oh, okay. Yeah, whichever one. Okay. At least I'll get some good treatment. So it's okay.
You actually get VIP treatment.
We treat everybody.
No. But he had mentioned at one point that you use, I don't know if it's discretion, where you can identify a patient when you are able to identify a patient who is more of which case is more of critical.
Like when you have admission in a male, when an emergency comes in, yes, I'll do the triaging. When you come to the ward, we're treating you all the same because you're all patients.
I won't ask much here. So no, I'm just prompted to ask because you did ask earlier on about the issue of those ones who were trained from outside. And I think part of the discussion, though it could be different depending on the person, but you mentioned that for them, they can even take longer.
Yeah.
They might even go maybe for a year or even 2 years just doing internship. Yeah. But I understand. And I think even here, we might have someone who was trained here, but they might even stay maybe longer in the ward because maybe this and we know yeah, but no, like grasping certain things and stuff like so they might be longer.
Yeah.
But then I also want to understand it from is it because I am doing internship. I don't know if I understand it from other sectors of or other institutions, companies, parastatals and that kind. Is it something that is paid for? Or is it something that every doctor should go
get paid for?
Or should do? Can't you just get into the hospital? You're employed, you're deployed, you start working. Do I need also to go under or through internship through someone? Because I think there are some people who are lucky with maybe not in medicine, other kind of institutions. The moment they finish their maybe economics, they went to work, they found work. Or even nursing, Yeah, there are those ones who do volunteering. They are deployed out of volunteering. And there are others who have not volunteered, and then they have also been deployed. And then there are also those ones who have been volunteering and they have not been deployed.
It's the nature of life.
Very, very unfair. So how is it in terms of internship when you are a medical doctor?
So for us, our career is it's a quite strict career. So you find that for us, you need to undergo internship. Internship is compulsory regardless of circumstances, because we be the you take an oath to save a life. They also take an oath to save a life. But for us, you have to go through internship because you are not yet having a full license. Remember, they give you a provisional license. Only when you have a full license, that's when you can take like work and apply somewhere for a job. So medicine holds you back. That's why there's a lot of controversy happening now with doctors, because they are complaining to say, no, we need to get jobs and stuff like that. Yes, everyone understands we need to get jobs, okay? But at the end of the day, you are responsible for someone's life, okay? So at the end of the day, you are responsible if someone lives to see tomorrow, or someone cuts their life short, okay? Trust you me, the difference is thin, and it can happen anytime, okay? We're in a field, one thing I would like to say is that we're in a field where things can go wrong at any particular point. I can be talking to you right now, and you find someone collapses. Okay, we need to be very prompt on reacting and treating those people. That's why in our field they don't allow junior resident medical officers to just like a medical doctor finishes and they go into like getting a full job. You always need to work for a year at least under supervision. In short, you need to be tested again for your competence. Yes, so it's very strict. So you need to work under supervision. They test your competence, because if they do not test your competence, you find their casualties. Okay, as she can attest, you find some things you have to learn them when you're on working at the hospital under supervision. Okay, so you can know pneumonia, you can know a different condition, you can know a fracture, but it doesn't mean that you can treat it just because you know it. It's not like economics when you say I can balance the books and the numbers, I'm good to go. Yes, in medicine you can have the information, but you also need the practical side. That's where internship comes, because as a medical student you do not learn all the procedures. No medical doctor who has just finished med school can come to me and tell me, no, I'm competent to handle the procedures. That's a lie. That's a lie, because knowing something is a different thing. Knowing the information is a different thing. Knowing how to handle that thing, the practical stuff and the information is also a different thing. So medicine is about information and practice. Okay, information and practice. You have to combine the two. So if you graduate from med school, you have the information. We take it, you have the information. But now you need to prove to us that you can also practice. Okay, that's why you need to learn how to do cesarean sections. You need to know how to handle fractures, all those different components. Because now, if we don't know those things, it becomes what? Casualty. And you find that our profession is heavily guarded. You can be sued any day and any time because of negligence. There's a thing whereby we do not tolerate ignorance. To say, I didn't know this. I didn't know there's no excuse like that in med school or in medicine. At the hospital, there's no excuse to say a patient came with this condition and no, I actually didn't know much about this. That's someone's life. Okay, that's where our internship is compulsory, because we do not want such mistakes to happen. Yes, and now that's where it comes in at government level. Junior resident medical officer, the entry level for a doctor is a junior resident medical officer. You are paid to be a junior resident medical officer. But the government cannot manage to employ everyone at the same time.
On internship
Level. Okay, so what happens now is they just pick certain numbers every year or after a year, then they enroll you. But what happens to say you're in a situation whereby you're not employed and you have to wait for 5 years to get a job? That's why people now take it into their own hands. They say, I can do internship for 1 year, then 1 year 6 months, or 1 year 3 months, then I can go and practice in a private sector or in a different environment.
So when you take up your own initiative to go to a facility or to a hospital, that means now there's no there's no pay for that,
You
isn't
are on
it?
your own.
You're
because,
on your own.
Because you're the one who took up that initiative.
So what you want is just to gain the experience.
Exactly. Because, trust you me, you're not a doctor till you get experience.
Okay.
Yes.
So the doctors that now are deployed under internship, the resident medical officers, they are the ones now that belong so much to the association, isn't it?
Yes.
At one point, the association had threatened to withdraw the doctors from hospitals.
Yes. And at one point, I was part of those who withdrew.
You withdrew from the hospital.
Yes, we withdrew. Reason being is that the issue here is that those people are the voice of the association. Okay, and you find to say in most hospitals, they are volunteer workers. Okay, and especially doctors and nurses, you find the majority who are working on the ground, who supplement the number, are the volunteers. Yes. So when those people say, okay, we want an allowance, we also want to start getting paid, they have a right to say, okay, let's talk to the government, and the government does not respond well, they have a right to say, no, let's withhold our services till we come to a negotiating bar, because we're giving these services for free.
So now one belongs to an association. I'm just thinking, belongs to an association, the association threatens you as a medical doctor or medical officer. You also have your own judgment. You are there, you want to get the training, the adequate training. Are you coerced by the association when they make the pronouncement, so we are going to withdraw our doctors? Or it's something that someone can say, no, I'm okay, I'm not complaining, and then I want to save the lives? Because you mentioned of passion.
Yeah, we mentioned of passion. Actually, for me, there's a grace period where I continued, and at some time they asked us to withdraw, everyone to withdraw. Yes, because now the issue here is that,
is there a punishment when you go against?
There's no punishment, but it's very embarrassing.
I think it was because of your equality.
Yeah.
You come into an agreement with the government, where they say, okay, this is what we have offered, break people, we force to volunteer. So now we withdrawn them so they can fill the gap. Yes, that dialogue, the association with the government.
Exactly.
Okay.
So now you find that the association will talk on your behalf, but again, as a human being, you need to have a conscience to say, what do I want to do with my life in the next 5 years, the next, because you can't just be seated and waiting in line. Okay, so that's where people now, actually on that one, we have got split decisions. Sometimes the association might say this, but some people might do another thing. Because people are really wanting to have their own job to take care of themselves. So now the association cannot manage to take care of everyone. So some people will abide, some people will not abide. But the association's job is just to speak out. No, we're facing this. But it doesn't mean everyone will comply.
Okay, interesting. So what do you think? The associations, Junior
Resident Medical Association.
Junior Resident Medical Association.
Oh, in fact, it's RDZ.
RDZ. So
Resident Doctors Association of Zambia. Yes.
Resident Doctors Association of Zambia. Do you think it's effective?
Well, it's quite effective.
I can support them. Their association is effective.
It's quite effective. I'm actually good friends with the president himself.
Oh, okay.
Yes.
The current president of the
Dr.
RDZ.
Yes. He's also at we work together. But even him, when he's trying to push these things, he's in a tough situation. But it's quite effective. He tries. The association tries its best. But again, no matter how much you try, you have to be patient as well, because you do not get results there and then. And sometimes he's under threat, Sometimes he might go under threat from different people. No, why doing this? Why doing this? But he's a guy who's selfless. That one I can assure you. He's a guy who's fighting for the welfare of doctors and so on and so forth. So it's quite effective. Most associations, like maybe their associations are on the comfortable side.
Oh yeah.
The pharmacists and the other people, they don't usually voice out themselves. Yeah.
I think the one for the pharmacist is also vocal. Is it the PSZ? I don't know about The one for Tendai.
I won't say anything.
We want that to be the president.
Yeah,
I won't say anything.
maybe it will be. We'll hear of it, because I think we have huge numbers which are about to be deployed. But I think the good part is with
Last time we checked, we were 29,000 nurses running a check.
29,000 nurses.
And this year they're deploying about 2,500 from the statistics that we got recently. And that it said with more, they might consider more of doctors.
Which one? So not this one we are expecting, the other 2,000.
The one we're expecting right now.
No, it's not the one.
It's not the one.
No. So there is another one we are expecting later on in some months.
In some month.
Yes, and then there is this one now, which will
We'll
be
cater
more.
for everyone.
Yes, we'll
But still, it won't
for
cater for all the nurses because they're 29,000.
No. Just wait. I think the government has a better plan for our DNSs and other health workers, where they will have a fair share. Yeah.
But the good part is that they've been deploying, they've been trying. So it's bit by bit.
Yes,
patience
I think it's the first time it has happened where we've seen thousands, 20,000 over plus
to be deployed.
being deployed under health. And of course, we've seen the same in other sectors like teaching, education, rather.
And I think because when it comes to healthy, when said deployment for health workers, it includes everyone. It's different with teachers. When said deployment for teachers, that's teachers only.
Yeah.
So I think in healthy, we should even be more proud that a lot have been deployed.
That's pretty true.
Yeah, I think the other time we had PhD says, so when you're deployed in Shangombo,
Don't refuse, just go.
Yeah, because I think it's the same with you. You've experienced Northwestern, maybe Solwezi,
Central Province.
a little bit
Eastern
of town
Province.
centers. How would you welcome an appointment or a deployment of places like Chiengi, Shangombo, Lukulu? These are
Far areas.
Yeah.
The PhD said there's no place which is far. So are you saying far?
Because we stay in Lusaka.
So as long as you take that oath, wherever you are sent is where you go to save lives.
Mm-hmm.
It doesn't say no, you'll be placed here, no. So it's up to you to say yes or no. Some people refuse. I know some people have refused to go to those places.
Mm-hmm.
And just refused an appointment to say, no, I can't go there. I would rather be this side. But as for me, I would encourage everyone just to go wherever they're taken. And eventually, you never know where life takes you. You might from there pick up another turning point and you eventually come back.
Mm-hmm.
The worst case scenario is you not having a job. Because jobs are very scarce these days.
Yes.
So if they are having a job and they're in a remote place, you're better than someone who's jobless but they're here.
Mm-hmm.
Because trust you me, the bills here are crazy. So it's better you get a job. Then from there, you work, and if you want to come back, you can still come back.
Mm-hmm.
But don't just say no because it's this place. I've heard bad things about it. Because at the end of the day, you're saving the Zambian people.
Mm-hmm.
Okay, because someone's mother might be that side. Even maybe the same minister's mother, maybe the minister's mother is maybe in a far place, and they have sent you there. You have to go. The president's mother maybe is in Choma. So you have to work for your Zambian people. Because if we start choosing, no, everyone wants to be this side, it's not ethical and it's not professional. So we're called to be professionals and just go wherever it seems to be, and life will take you wherever it takes you.
Mm-hmm.
And you never know.
Interesting. Yeah, so this is the Smart Podcast sponsored by Elitrasmart Medical Supplies Limited, your number one producer of healthcare attire. So if you're looking for a nurse, you're a doctor like Dr. Mkandawire here, and of course a nurse like Tendai, and an upcoming doctor like myself, you can reach out to Elitrasmart. They will be on hand to give you the best of your attire, your uniforms, nicely designed, taking good shape of your body size and everything else that's needed. We're across the country with different branches, and of course you can call us on the numbers scrolling down. Yeah, so now let's just go back to your hospital experience. You had mentioned earlier on that you first started at Levy, started with the surgical what?
Surgical department.
Surgical department. It's a department. Okay. I've been there before.
Okay.
Yeah, I've been there. Quite clean, I should mention.
Okay.
And I didn't have so much of an interaction with the nurses. I found they have knocked off.
Nurses don't knock off. No.
They were changing
With the exchange shifts.
shifts.
Yes.
At COF,
Shifts.
shifts.
Yes.
Yeah, they were,
Yeah.
But quite a very clean department there at Levy.
Yeah.
Yeah. You've worked with Tendai before. How was your experience in the surgical?
In the surgical.
Let's start with casualty. How was it from casualty till you go to the wards? And you can also talk about the person who was mentoring you and would you rate them? Have they been a good mentor to you? If you are deployed to Shangombo, will you deliver? Yes.
Yeah, so one of we call it key performance index, is that as a medical doctor, you need to rate yourself. And you'll be rated by others, but yourself, you need to judge yourself to say, before leaving a department or in a department, can I do this procedure? Can I not do this procedure? Okay, and work on that procedure. Don't feel shy to say, no, okay, it's fine even if I don't know. Because procedures will haunt you. You'll be alone in a certain particular area. Okay, so for me, casualty is one of the most demanding places to be. Emergency. Ish. You feel like you have gone for war. Sometimes we even call it Baghdad with my friends. No, until Iraq. Yeah, so that why I'm saying that is because anything can happen that side. You might have a patient just come in and they're already on the ground. Okay? You might have a patient, they were just okay and conditions change. So it's a department whereby anything can go wrong at any particular time. You have to be aware of that.
So who goes to casualty?
So casualty is what we call the entry point for every patient who comes in. That's why we do a triage. We assess, okay, depending on your condition. If it's a medical condition, we send you to the medical ward. If it's a surgical condition, you've broken your bone, you're having a cut, you're having maybe intestinal obstruction, we bring you to the surgical ward or to a surgical casualty. So there's a triage of which how we refer patients. So each patient should be seen by a particular doctor. Okay? So when you're in surgical department, you see all the surgical cases and you handle them. Okay? And so as I said, it's a very demanding place because anything can happen and you need to do teamwork. Okay? Though there are some doctors who just want to work alone, then when things get bad, that's when they call someone. No. When the patient comes in, you discuss with your team, okay? The nurses there, you discuss, what do we think about this patient? What can we do? And rapid response, you start working on it. No, let's get these drugs, let's do this. And that way it makes your life easy. Trust you me, when you're working with the wrong people, your life can be very hard. Okay? So the other thing you need to know is teamwork. You need to have a spirit of teamwork. Ask, okay? For example, you can find she's been in the surgical unit for a long time. She will know more than me. Okay, me I just came in just now. Okay, because of maybe your pride, you won't ask. You get the point? So the most important thing is a good doctor is a doctor who knows his limits. Okay, know what you can do and what you cannot do. Okay, because if you are Mr. Know It All or Dr. Know It All, you cause more calamities than usual. Okay, because certain things can be prevented. Okay, if we discuss on a certain condition and we find this patient is having this condition, we find the patient is well to do. Okay, so casualty is demanding, and sometimes you need to know your limits. Most of the time you need to know your limits, what you can do and what you can do, and then if you cannot do it, you should remain comfortable saying, no, man, I can't do that. The following day you should be the one leading that procedure. Yes, and teamwork, and always.
Would you say there's teamwork among doctors?
Yeah, there's good teamwork. There's good teamwork. Just that in some situations, maybe there can be discrepancy, but always doctors work as a team. Okay, because we as the junior resident doctors, we need to we work together. If we see though this thing is too much for us, we have the right to call someone a senior above us. Okay, there's what called senior resident. We have a right to call a consultant to say, okay, we have done this ABC. The condition is still the same. Can you come and assist us? Okay, and that person will definitely be there to do it. Okay, so there's a lot of teamwork involved in making sure a patient's life is stable and they are well treated. Okay, so I can say there's good teamwork between the doctors and the nurses. It's just that sometimes fatigue is too much. Okay, so you have to know how to manage your fatigue. How you know how to manage your fatigue? You need to weigh yourself. You know, when you knock off from work, you can't go and start drinking and playing around. You know that tomorrow you're also going back.
Going back for work.
Yes. So what I can say about the medical career is about also discipline. You need to be disciplined to calculate whatever you do. You cannot be reporting for work drunk. You cannot be reporting for work in a tired manner, because trust you me, the best doctor is a well-rested doctor. Yes, because he's going to execute more than the one who's tired. You can be good at your job, but if you're reporting tired every time, you will make even the simplest mistakes. Yes, and the simplest mistakes in health. That's why health is a very interesting and critical department. In health, the simplest mistake, the wrong administration of a drug, can change someone's life. Someone can easily lose their life. Okay, delaying in time to respond, someone can easily lose their life. Okay, so we need. I feel like for us doctors and nurses, we need to take care of ourselves first before you take care of a patient. Because if your health is crashing, that's why we brought in the issue of mental health. If your health is crashing, you make funny, silly mistakes which will easily cost someone's life.
Yeah.
And you know, when you cost someone's life, it will haunt you even for the rest of your life.
Tenda is disagreeing that there's no teamwork among doctors.
Yeah, I disagreed.
No, but
I was looking at your facial expression. I was like, maybe there's no teamwork among us, maybe even the doctors or the nurses.
The teamwork is always like I think there's a way you explain. There's always teamwork, but there's always comes a time where you're supposed to disagree, so that you can come up with the right choice, right medical.
So doctors and nurses disagree
Yes, there are times like you say,
when dealing on a patient,
let me
working on a patient.
say he's written fluids for a patient who has a heart condition. He's put 3 liters. Then I'll tell him, no, you can't give these liters to this patient. He will try to once to defend himself. Then I'll tell him, but why are we giving this type of fluids to this patient who already has a cardiovascular condition? So we're bringing out points both
So
ways.
why is the difference in opinion there?
Because books, let's say you use Google. When you come here as a patient, you come with your Google. You already know something.
No. The disagreement is between the nurse and the doctor.
Yes, books are different, remember. You might use a different book. I might have also used a different book. So when we discuss that point, we also come up with one conclusion. Okay, so yes, this aligns, this is. We brought in our defense. So, okay, so let's go with this way. Then we treat the patient gets
an
better.
instance where, due to the argument between the doctor and the nurse of what medicine or what should be prescribed to a patient, then a patient life is lost? Because I'm seeing that situation.
No.
You are going to take 2 minutes to discuss
No.
certain.
So those issues come in when you're just like you've done the important things. So now when you are sitting down now, we
are revealing, like let's say when they're dancing the patient, the doctors, they'll bring me the file and the drug charts. So now because me as a nurse, I'm an advocate for the patient. So I speak for the patient who can't talk, but me, I have to be their voice. So I'll go to the doctor. I think this what you've written, we can't give to this patient. Then you ask me why. If I give my reasons, you say, okay, what you've said actually makes sense. It's actually what we should go with. Even checks his books. Most of these people have got, what books are those?
those big books.
Yes.
So in most instances, you find that doctors are wrong and nurses are.
Not most instances, because at the end of the day, remember, we're treating a human being. It's not like we're dealing with trees or animals or what, but we're dealing with a human being who we say they're coming from a family. This could be a mother, a father, who everybody wants them to go back home safe and sound. So when we are agreeing on something, when we disagree on something, we need to find an alternative where we're both going to agree. Let's say he's an intern, and then there's my senior as well. He has his senior. When we feel like both of us cannot agree, our seniors, they'll come in and say, okay, what are we discussing about? Then they turn out like, okay, this is how it is. They'll come up with one conclusion. At the end of it, they were supposed to agree for the betterment of the patients. We're not in competition at the end of the day because we're there for.
It's not competition, but I'm also just looking at a situation where doc
There's a scenario where you both disagree on the
yes,
patient.
yeah, because the situation you've explained is of the aftermath, maybe the treatment you've treated the patient and everything else. But there are instances where the patient is just lying on the bed there. You need to administer something to them, and then the doc says, "Sister, can you give me this?" And then you as a sister, as a nurse, say, "Doc, no, we can't. These are many amounts, or this is wrong medication."
So in such some circumstances happen, when the doctor says this, you'd say, okay, I can give you to give the patient. At that point, when you tell him, I can give you to give the patient, you understand, okay, the nurse really knows what she's talking about. Then you're going to agree, say, okay, this is not supposed to be given to this patient.
So in that case, the doctor will agree with what the nurse has said.
Because you've brought in evidence. Remember, the nurse spends much time with the patient. So we tend to notice much of the things that go wrong with the patient because we'll be there observing the patient. Remember, on the entry point, when the patient walks in the hospital, the first person to be in contact with that patient is what? The nurse. The nurse will do the vitals. When you see the vitals are not okay, we'll go to the doctor. Oh, the BP was high. Then the doctor will be like, okay, we'll give these drugs. Then you're going to give the drugs. So at that particular point, it's for the betterment of the patient.
What has been your worst experience with a doctor?
Well, we have to agree on one thing. I think one experience was you do a scan, it has shown that it's an intestinal obstruction. And
After doing a scan?
Yes, you tell the doctor the patient is supposed to be taken in for theater, it's supposed to be an emergency. And then he says, let's wait for my boss. Why can't you call the boss? It's late. No. Call the boss, you talk. Because this patient needs to go in. If we delay, we're going to lose the patient. So when you feel like you have not reached an agreement with the intern, call the boss direct on your own. Ask us if we do that. We'll call their boss. We'll talk to their boss. The boss will know what to do next.
Interesting. Doc, what has been your worst experience? You've worked in surgery department, the surgical ward. Yeah. Now you're working in orthopedics, is it?
Now he's in obs and gyne.
Now he's on obs and gyne. That's like gynecology.
Yes.
And the first obstetrics. Obstetrics
and gynecology.
Mm-hmm. I know these terms, eh?
We can see. We can tell.
Yeah. So, obs and gyne. Yeah. What has been your worst experience in your line of duty while you've been as an intern working?
The worst is, of course, every doctor's worst experience is losing a patient's life. Mm-hmm. Yes. The worst for me is just when when you're doing your call, there's what you call call, mm-hmm. where you work from the morning to the following day.
Yes.
Yes. So sometimes what happens is you arrive too late. What I mean by too late, some patients, they call, come and see this patient. You're rushing there. We start resuscitating, but there's nothing, sometimes as a doctor, there's nothing you can do. And the worst experience is losing the life of a patient. I think that's the worst thing in the healthcare setting, where you do your best and the patient still
dies.
How many lives have been lost?
Yeah.
How many lives have you lost in your line of work?
Like why I'm treating them. I haven't lost any, like I'm treating them.
He started with surgery. Surgery, we always keep them alive. Surgery, we keep them alive.
You had good nurses on your right hand.
Yeah, the good one, the best.
Interesting. Interesting. Yeah. So where are you, obs and
gyne?
Gynecology. Yeah, gynecology. Yeah. Okay. So how is it going there?
It's quite busy. It's quite busy because, when dealing with women, you need to be patient. And there are a lot of things which happen there. Things can go wrong.
Gyne deals with women?
Yes, just the women's department.
In short,
you're a doctor doing with women?
Yes.
Oh.
Yes.
What are you doing there? Interesting. What are you doing in the women's department?
So we assist with different conditions. Mm-hmm. Okay, so obstetrics deals with deliveries.
Okay.
Deliveries, and also any bleeding conditions. Women can come with, maybe they're complaining, or pregnancy in short.
Yes.
Obstetric, we're dealing more of pregnancy. What can go wrong? Because in a pregnancy, we need to do antenatal care
Yes.
and all those parameters. So anything can go wrong with a pregnant woman. Yes. So we're dealing with that, and also dealing with normal conditions like fibroids. Okay, ectopic pregnancies, fertility. Okay, all these conditions. So it's a broad department, and it's well regulated. So we keep it full circle, and it's quite busy because you always need to be everywhere. Yes, at a particular time, you need to make sure you have done.
Then
your duty.
how many babies have you delivered?
Quite a number. Quite a number. More than 20.
How has been the experience so far?
It's been good. The relief of knowing that you've helped bring a child to life.
Yeah.
It's quite nice. It's very nice. So I can't complain. It's a good department. Though the only thing that's difficult is the busyness. Yeah.
How many deliveries does your hospital have? Approximately, maybe in a day, a week, month?
It depends. There are crazy days and there are good days. So in a day you can even have more than 50. Yeah, deliveries more than 40, depending, because it depends on the admissions we're doing.
Yes.
Yeah. So it's a big.
And the
hospital.
levels of production in Lusaka also.
Yeah, Lusaka, the population.
Levi is a referral hospital, remember?
Oh yeah, so most
Yes.
of them
So most are being referred to Levi.
referred to Levy. Okay.
So it's a quite big number. Yeah. So we deliver quite a lot of babies, and we look at different conditions. Looking at how big the hospital is. Yeah.
So
It's going well.
so far in Obs and Gyne, what can you say is the most challenging thing? Because I think I've heard most doctors complain saying Obs and Gyne this, but I've never taken time to sit with one and ask them what's really the challenge.
The challenge one is politics.
Okay.
You need to know how to handle yourself and be patient, because you differ with people with different opinions. A nurse will tell you this, your senior will tell you this, and your fellow colleague will tell you that. So you need to be patient, because if you're that type of person who just wants what you want to be done, you'll find it frustrating. Okay? Because any simple mistake can really cause things to go wrong. Okay? But the other big problem what we have in Obs and Gyne is the fatigue. Okay? Because it's a busy department, very busy. So that's why most of them complain, because you're never free. Trust you me. And when you're free, you're tired. So it's rest and back to work, rest and back to work. But at the end of the day, you get fulfillment because you're doing and you're saving, you're doing a good job, and you're saving, you're bringing babies to this world. So it's quite interesting.
So how has this internship boost your confidence now as a doctor? Since you've been to surgery, I don't know which one will be your next department. You've been to surgery and now you're in Obs and Gyne where most people complain. So how is it that boosts your confidence as a doctor?
That one you cannot explain. The confidence is just there. I don't know. It really, I feel like everyone needs to, every medical, those medical doctors who just finished, they need to take part in internship or start their internship, because internship boosts your confidence levels, because it's different to read about something and different to treat something. So as I am talking right now, there are many conditions I can handle on my own. Okay, so it has really given me that confidence. As a doctor, when you have confidence, it's easy for you to talk to patients, to treat the patients, and so I can just say my confidence has gone at quite a good level, where I'm comfortable, but I'm not comfortable, but I'm comfortable. Yeah, I'm happy with where I am. Yeah.
Okay, and how have you survived? I know there are times when your seniors are too hard on you.
When you don't do a good job.
Yes.
Yes. So one thing I would tell you is that don't take things personal. Yes, number one. Otherwise, if you have a small heart, you suffer and you feel like the world hates you. Okay? Because there's a principle, never outshine your masters. 48 laws of power.
Number one.
Yes. Never outshine your master. That means that in terms of intelligence, no. It also means emotional aspect. Okay, you need to read your boss. Okay, how are they? How is their mood? Okay, how you study your person because you'll be working with this person every day. Okay, so sometimes your boss will say, "Oh no, this is," you mean well, but you take it in a bad way because even you are having your own life issues. So what has saved me is or helped me is don't take things personal. Always laugh about it. Like she's always laughing about things. So even me, I just laugh about it, and time goes on, and you learn to realize that the same bosses who are giving you a hard time, they actually your good friends. Because me, the bosses who give me a hard time, they ask me, we talk. How are you? Okay. So you become good friends. Or you know, they just want to bring out the best in you. So don't take things personal, and always take it as a learning experience. Because remember, you're not always going to be under them. You also reach a level whereby you are also supervising people. So if you take it too harsh to say, no, they are mistreating me, no. Learn to be humble and learn from people. Yeah.
Interesting. We earlier on talked about the doctor-nurse relationship, arguments on who prescribed what and what should be given to a patient and stuff like that. I just got thinking, because I think we've heard this from the Terrances and everything else. You can confirm if it's true or not, if it happens or it doesn't. Do young doctors, or maybe even doctors, take advantage of nurses? We've heard of that these guys have relationships going on.
For me, I feel like that is like a movie theory. Okay, movie theory. In as much as the other workplaces, you find there are also ladies in the bank, and there are also managers in the same bank. In the sense that what you watch in movies, you want it to happen in real life, okay? Because in the movies, you find nurses are always doctors. You take it in real life because that's what you're always used to seeing. But when you go for work, one thing I can tell you, people are very professional. It's a professional workplace, and you just interact like that. From there, life goes on, okay? But what people see in the movies is what's spoiling our reputation, because you find no this. So always there are going to be speculations, but from my own perspective and what I've seen working is that most of the time it's a movie theory.
But it's a hospital, and then people meet as a society, and they get to interact, and as colleagues, and others might advance from there.
Yes.
So is there a possibility? Because I think we cannot just render it as a movie theory, because even in movies we find that these two are strangers and everything else.
No, it's a possibility. There are doctors who have wives who are nurses. Yes, so there are also doctors who are married to other professions. So we can't say that no, what people are speculating, because people, what they speculate is what's in the movie theory.
No, but kwa batinga balelanda itakuwa bokupa ichu ishipako chifumeni ishipako tumodilo tunono.
Just like in every, like you said, just like in every.
Are you agreeing or disagreeing?
I'm agreeing with him, but just like in any working space, there are women, there are men. You never know where you're going to find your soulmate. You never know where you're going to find your person. You might find them in the hospital. You might find them in the bank. It's not determined where you're going to find them. So some have managed to find love in the hospital. Some have managed to find love outside the hospital. So
some have managed to find disappointment in the hospital.
In the hospital. And some have
dumped in the hospital.
In the hospital. It's the same as when you work in the bank, you find somebody in the bank, they still dump you in the bank. It just ends there, but you continue working, you still continue keeping it professional. Let's not your work get affected because you had a relation with somebody.
That's why I'm asking, because it's something that is at the back of my mind, and then I was asking just as a straight question, but also the effect of the work relationship. We've had situations, I think we've had situations, or maybe even in movies or even in books. They're in the same department, they're in a relationship, they are dating, doctor, nurse, the relationship ends, the nurse has to be changed to a facility or a hospital, or maybe a department, so that they don't get to see that doctor. Or maybe now it becomes confusion. So it might affect work.
I've never seen, I for one, I've never seen that.
Why are you sleeping?
What do you mean? Are you okay? I for one, I've never seen that because I work in a hospital. I've seen people that have dated each other. they have gone separate ways, but they still work like nothing ever happened. Because they remember their relationship was away from the hospital, was not in the hospital. In the hospital is doctor-nurse relationship, nurse-nurse relationship. And you keep it like that. The same at your workplace. It's the same at your workplace.
Is what you're saying the truth?
Yes.
The truth and the truth.
And the truth shall set me free.
So, Doc, you are in obs and gyne. What are you specializing on?
When I'm done with my internship, I would like to do orthopedics.
Why?
Orthopedics. What is that?
Okay, for the bones, eh?
The bones.
Yeah, doctor of the bones.
Okay.
Fractures, soft tissue injury.
Oh yes, me who is a sportsman.
It's orthopedic and traumatology. Yeah.
Wait, sportsman. I think we need to have a podcast so that we can also know about you.
We also know it's sport.
Quite a number.
In Osaka. So yeah, I would like to do that. Not because when I was finishing med school, or when I became a doctor, I wanted to do maybe internal medicine and other things. But working in orthopedics has just given me a different view on life. Like, it's something which I just enjoy doing. You know, it's something whereby even if I'm called at 01 to say come to the hospital, I can go there. Okay, because it's something that I enjoy doing. Okay, so there's a difference between choosing a department because you know more about it and enjoying that department. Because at the end of the day, you spend the rest of your life in that department. So if you're frustrated, that's why you see those frustrated people now shouting every day. So I feel like ortho for me is where I find more happiness when I'm working. Like I can work regardless of the politics. I can manage, and I'm good at that.
Okay. So since we've talked about much about internship, we've talked about orthopedics, we've talked about obs and gyne.
Yeah.
And how many months are remaining for you to finish your internship?
About 5.
5 months. Okay, so when you're done with internship, do you still plan to continue being in the hospital, or you plan to do something else away from that?
I still plan to be in the hospital, but not in the government sector.
Okay.
So maybe I can go to the private and yeah.
All right.
And earlier on, we were discussing
We'll see where life takes us.
We touched on briefly about deployment and everything else. I think it's just the hope of almost everyone that they are deployed in some sort of a government facility, because like you had said, that's where we are going to have a very like everyday interaction with these people, especially the ordinary ones who really need the doctor's help. What's the plan if the government deploys you? Or maybe we touched on that. What happens if you're not deployed as a medical doctor?
What happens is that you first have to establish yourself. I think before starting internship, that's the first question you need to ask yourself. Okay? What happens if they don't get you is that you have a backbone. You already have a full license. Okay, so I remember every day I see adverts for, we need a senior medical doctor. Okay, so there's a loophole for you to survive because there are many hospitals which need doctors. Even the same, there's another entry point for doctors. Even senior doctors are being accepted at that level, not internship. Some enter at senior level. So it's just to keep the hope alive, but eventually you can find a job in the private, even the government itself, you can find there's a loophole somewhere. But I do not see most people suffering after internship. Yes, because they have experience. And when you have experience, you can go somewhere and say, I can do this, I can have these qualifications, and they find something for you to do. Yes. Rather than you being seated to say, I'm in misery, they haven't gotten me. You keep making noise on media, and you become frustrated because you keep eating yourself inside. At the end of the day, mental health gets there to the worst of it. Okay, so you need to, as a medical doctor, you need to look for the best possible scenario. Okay, if this doesn't work out, I can do this. Remember, that's why you went to school. because it opens up your mind. Okay, sometimes you find that you can start doing a business. Okay, there are doctors. I think you know Dr. Clive.
Yes.
Yes, he's a doctor who's doing fine. He's a photographer.
He started with photo. He was a photographer. Then before he was deployed, I think we as Elitrasmart Limited, we've used him several times to get photos from him. We just found him on Facebook, then started getting photos using him. And that time, he would even tell us, I'm actually a medical doctor, but then I've chosen not to
go the medical
where I sit down, I cry about it, but I've decided to develop a business. And afterwards we were deployed, and then he has still continued to keep his business. He's running here in Lusaka while he's deployed out of Lusaka.
Interesting. We need to see him, eh?
Yes.
He needs to get his side of the story. Most of our viewers, Doc, are watching. We have a very huge population of young nurses watching, and other professions and health, pharmacy, biomed, and others. And I'm sure they'll watch you. They'll be very excited. And some good nurses and just other females are looking for doctors to marry. Are you married, Doc?
I don't know. I'm not married.
Okay.
Yeah.
What's the current status? Let's give them the chance. See if they might... Yeah, so Uwe, Doc is not married there. His relationship status keeps on.
I didn't say that.
We just put query.
Question mark.
So you have a chance. Yeah. I think. Thank you very much for sitting with us.
It's a pleasure. I've really enjoyed, and I would like to keep coming again.
Yeah, you will. It is open. We are so much. We love health. We want to see that most of the priorities under health are touched, so that we keep on informing ourselves, and those ones who would love to listen to something that is valuable, worth informative, listen to. And we hope that we keep on having more interesting conversations. We engage you back again when deployed, or the aftermath of your internship.
The journey continues.
The journey continues. We are still discussing. Yeah, but we are just a phone call, a text message away.
Okay, sure.
And then you reach out to us.
It's quite an honor, and I'm very grateful. Thank you for giving me such a big platform in this time and era where there are a few mentors in the medical field, and in health professional. We need people to keep advocating, and this platform is one of the best out there.
Thank you very much, and I thank goodness we have Tendai right there, who is always on hand to ensure that we keep things on track to discuss health.
She's the mini machine behind.
Yes. Yeah, she's a good one. This one, she's a very good partner.
She's what the country needs.
Yes. Unfortunately, to need Tendai. Imagine. Yeah. So Tendai, thank you. We'll see you at your Chilanga Modilo.
Thank you very much.
I don't know if the groom is still there waiting. You've kept him waiting for long. It's sunny out there.
It's more like a nurse who's taking care of patients. They're always very patient in waiting. So that's how the man is. Thank you very much.
The patients. Who told you the patients are patients?
The nurses always wait for the patient. Like they're very patient when treating these patients.
Oh.
Yes.
That's one of the qualities.
Patience.
Yes.
Okay. Doesn't patience kill?
No, it doesn't.
It actually saves lives. Because if you are panicking, you kill a life. You kill someone. You end someone's life.
How many lives have you saved, madam?
A lot.
What's a lot?
A lot. I can't even count.
Millions. No, Doc, thank you very much.
Thank you, Mr. Kala, for having me. Thank you, Tendai, for having me. It's a pleasure. And hoping to see you again.
Yes, definitely. Tendai, have a blessed weekend.
Thank you very much. And to our viewers, remember, a cleanness is a happiness. Visit Elitrasmart Limited to get your uniforms today.
Are the uniforms for free?
To buy.
You remember, you get quality with Elitrasmart.
Yes.
They are one of the best in the country, and you need to look good as a health worker, because one of the qualities of a health worker is neatness and cleanliness. As in as much as we are treating these patients, we need ourselves to look presentable, because your appearance says a lot about you, even before you speak to someone. So Elitrasmart, just opposite St. Patrick's here in Osaka, is one of the best for your medical supplies and your uniforms. And stay in tune to the channel. And God bless.
There we have it. Elitrasmart, your number one company. This is the Smart Podcast. Thank you for watching.